Question number 3. Can I get a flare during pregnancy? The answer to this is yes. It is definitely possible, in fact, sometimes quite likely, depending on how you looked before you got pregnant, for you to have a flare during pregnancy. The trials show that if you can get pregnant after having no flares during 6 months prior to getting pregnant, while taking a medication that you can continue during pregnant, that you dramatically reduce the likelihood of having a flare during pregnancy. Another great way of avoiding avoiding a flare during pregnancy is to continue taking your Plaquenil while pregnant. The studies show that taking Plaquenil while pregnant reduces the likelihood of having a flare during pregnancy and increases the likelihood of having a really good outcome for the baby. Now, if you do have a flare during pregnancy, it can be a little tricky to differentiate the symptoms of a flare from the symptoms of being pregnant. So people who are pregnant will commonly note that they feel tired, that they may have swelling in their legs, they may feel some shortness of breath, and they just generally don't feel really great. A lot of those symptoms are similar to symptoms that people experience during a lupus flare. So it's really important that you continue to follow not only with your rheumatologist, but as well with your high-risk OB-GYN to ensure that you guys are doing everything that's needed to make sure that you're able to differentiate between symptoms of pregnancy and symptoms of a flare. If you do have a flare, there are treatments available for the flare, and it usually consists of corticosteroids, which can be given safely in certain doses, but higher doses of corticosteroids can have implications for both mom and the baby during pregnancy. So it's really important to be sure that you follow all of the instructions and that you keep open lines of communication with your healthcare providers during your pregnancy.